Have you ever wondered what causes vaginal infections? It's a question that might seem a bit daunting, but it's crucial to understand because these infections are quite common. They're not something to be embarrassed about, but rather, something to be aware of and proactive about. One of the most common types of vaginal infections is bacterial vaginosis. This isn't a sexually transmitted infection, but rather, it's caused by an imbalance in the natural bacteria found in the vagina. Normally, there's a delicate balance of good and bad bacteria in your vagina. However, when something disrupts this balance, the harmful bacteria can grow too much and lead to bacterial vaginosis. The symptoms of bacterial vaginosis can vary, but they often include unusual discharge that may be white or gray and thin. Some women also notice a strong fishy odor, especially after sex. Other symptoms could include burning during urination or itching around the vagina. But it's also important to note that some women with bacterial vaginosis don't have any noticeable symptoms at all. If you're experiencing any of these symptoms, it's important to see a healthcare provider. They can diagnose bacterial vaginosis with a simple exam and lab test. The good news is that bacterial vaginosis is treatable, usually with antibiotics. These can be in the form of pills that you swallow or a gel or cream that you apply to your vagina. But here's the thing. While it's good to know that bacterial vaginosis is treatable, it's even better to prevent it in the first place. That's why regular gynecological checkups are so important. They can help catch any imbalances early before they lead to an infection. And even if you're not experiencing any symptoms, it's still important to get checked. Remember, some women with bacterial vaginosis don't have any noticeable symptoms, but the infection can still lead to complications if left untreated. So there you have it. That's a quick rundown on bacterial vaginosis. It's common, it's treatable, but prevention is always better than cure. Remember, bacterial vaginosis is common and treatable, but prevention is always better than cure. Moving on to our next type of infection, fungal infections. The most common type of fungal infection is a yeast infection. It's caused by an overgrowth of a type of fungus called Candida. This fungus is naturally present in our bodies but can sometimes grow out of control, leading to an infection. Common symptoms of a yeast infection include itching and burning sensations in the vaginal area. You may also experience a thick white discharge that's often compared to cottage cheese. It's important to note that not everyone with a yeast infection will have noticeable symptoms, so it's always a good idea to get regular checkups. Treatment for yeast infections typically involves antifungal medication. This can come in the form of a cream, ointment, or even a single-dose oral pill. But remember, it's crucial to visit a healthcare provider for a proper diagnosis before starting any treatment. Preventing yeast infections often involves lifestyle changes. Douching, for instance, can disrupt the balance of bacteria and yeast in your vagina, making you more susceptible to infections. So, it's best to avoid it. Wearing breathable underwear made from natural fibers like cotton can also help maintain a healthy environment down there, reducing the likelihood of a yeast overgrowth. Fungal infections can be uncomfortable, but with the right habits and treatments, they can be effectively managed. Now let's delve into a sexually transmitted infection, Trichomoniasis. Trichomoniasis, often shortened to trich, is an infection caused by a minuscule single-celled parasite known as Trichomonas vaginalis. This unwelcome intruder can be passed from one person to another through sexual contact, making it one of the most common sexually transmitted infections. Those affected might notice symptoms that are hard to ignore. Women, in particular, may experience a frothy, foul-smelling discharge that is often yellow or greenish. Discomfort during intercourse and a burning sensation during urination are also common signs. But it's important to remember that not everyone will have noticeable symptoms. Some might carry the parasite without even knowing it. When it comes to treatment, the good news is that trichomoniasis is usually curable with antibiotics. However, it's crucial that both partners seek treatment to prevent a game of ping pong with the infection. And here's where we stress the significance of prevention. Practicing safe sex is not just about preventing unwanted pregnancy. It's also about protecting ourselves from infections like trichomoniasis. Using condoms correctly and consistently, limiting the number of sexual partners, and regular testing are all crucial steps in maintaining sexual health. Trichomoniasis is a reminder of why safe sex practices are so important for our health. So let's keep the conversation going, spreading knowledge and awareness instead of infections. It's our bodies, our health, our responsibility. Finally, we tackle the topic of mixed vaginal infections. Now, it's not uncommon for more than one type of vaginal infection to occur simultaneously. This is what we refer to as a mixed infection. It's a bit like throwing a party where uninvited guests show up, and suddenly, you're dealing with more than you bargained for. The tricky part about mixed infections is that symptoms can vary widely. Imagine trying to identify all the guests at your party solely based on their behavior. Some might be loud and boisterous, while others might be quiet and unassuming. Similarly, in a mixed infection, one type of infection might produce more noticeable symptoms, while another might be more subtle. This variety in symptoms can make diagnosis more challenging. It's not always easy to pinpoint exactly who's causing the commotion. That's why comprehensive testing is vital in these cases. It's like having a guest list for your party. Knowing exactly who's there helps you manage the situation more effectively. Once a mixed infection is identified, a personalized treatment plan is typically developed. This plan is designed to address each type of infection present. It's crucial to follow this plan and complete all prescribed treatments, even if symptoms appear to improve before the treatment is finished. It's akin to making sure every last party crasher has left before calling it a night. Remember, it's not just about treating the symptoms, it's about addressing the root cause. Treating a mixed infection effectively means understanding and addressing each type of infection present. This is where healthcare professionals come in. Their expertise and advice are invaluable in managing these complex situations. Mixed infections remind us that our bodies are complex, and so is the care they require. Stay informed, stay healthy.